Hello, everyone. So let's discuss about polycystic ovary syndrome. It is a very common condition in which there is hormone imbalance and it can cause irregular periods, increased hair and acne, and it may affect fertility. It is also associated with obesity and increased insulin resistance, and therefore it increases the risk of certain conditions like diabetes, heart disease, and other conditions later in life. And women with PCOS can reduce the risk of long-term health problems by having a healthy lifestyle and maintaining normal body weight. So what is polycystic ovary syndrome? PCOS is the short form, and it is a condition that can affect your periods, fertility, hormones, and aspects of your appearance. It can also affect your long-term health. It affects about 2 to 26 in 100 women. And this information is about the effects on the long-term health and the treatment options available for PCOS. What are polycystic ovaries? So these ovaries are slightly larger than normal ovaries, and they have twice the number of follicles, and these follicles are the fluid-filled spaces within the ovary that release the eggs when you ovulate. That is when you release the eggs. So you can see this is the normal ovary and the polycystic ovaries. These are slightly larger than the normal ovaries. And these are the cyst, that is many fluid-filled spaces. So at times they don't rupture and there is no release of eggs and there is no periods. And having polycystic ovaries on ultrasound does not necessarily mean that you have polycystic ovary syndrome. Women with PCOS have symptoms as well as polycystic ovaries. What are the symptoms of PCOS? So there can be irregular periods or no periods at all. There is increase in facial or body hair, which is known as hirsutism in medical term. There can be loss of hair on your head, being overweight, experiencing a rapid increase in weight, or having difficulty losing weight, oily skin, acne, difficulty becoming pregnant, that is, there will be reduced fertility in some women. There can be depression and psychological problems as well. The symptoms vary from women to women, and some women have very few mild symptoms, while others are affected more severely by a wider range of symptoms. It is a cause of fertility problems in women, as we discussed before. However, you may still become pregnant even if you do not have periods. So if you do not want to become pregnant, you should seek advice from your clinician about contraception. So what are the PCOS symptoms? So there is excessive body hair growth. There can be weight changes, trouble losing weight, ovarian cyst, that is the fluid-filled spaces, irregular or missed periods, male pattern baldness, thinning of hair, high testosterone levels, that is the male hormone level, it can be high, insulin resistance, fatigue, acne, mood changes, and trouble conceiving, or there can be risk of infertility. What causes PCOS? Exact cause is not yet known, but it sometimes runs in families. If any of your relatives, like your mother, aunt, sisters, they are affected with this condition, your risk of developing PCOS may also be increased. And the symptoms are mainly related to the abnormal hormone levels. So there is the hormone testosterone, which is also known as the male hormone. And that can also cause PCOS. It is a hormone that is produced in small amounts by the ovaries in all women. And women with PCOS have slightly higher than normal levels of the hormone testosterone. And this is associated with many of the symptoms of the condition, like acne, hair growth. Another hormone is insulin, and it controls the level of glucose, which is the type of sugar in the blood. If you have PCOS, your body may not respond to insulin, and this is known as insulin resistance. So the level of glucose is higher. And to try to prevent the glucose levels becoming higher, your body produces even more insulin. High levels of insulin can lead to weight gain, irregular periods, fertility problems, and higher levels of testosterone. How is PCOS diagnosed? So having polycystic ovaries on an ultrasound scan does not mean you have PCOS, although ultrasound is helpful and we can come to know about the polycystic ovaries. So women with PCOS, they have symptoms that come and go, particularly if their weight goes up and down. And this can make it a difficult condition to diagnose, which means it may take a while to get a diagnosis. Diagnosis made when you have any two of the following, like irregular, infrequent periods or no periods at all, an increase in facial or body hair and or blood tests that show higher testosterone levels than normal, that is the male hormone is high. Ultrasound scan that shows polycystic ovaries. Now, what could PCOS mean for the long-term health? So there are some risk of developing long-term health problems like insulin resistance and diabetes. So if your blood sugar does not stay normal, this can lead to diabetes. And 1 or 2 in every 10 women with PCOS develop diabetes at some point. And if diabetes is untreated, this can cause damage to organs in the body. And you're also at high risk of developing diabetes in pregnancy. So during the pregnancy, you will be offered a blood test between 24 and 28 weeks of pregnancy. Also, your risk of developing diabetes is increased further if you are over 40 years of age, have relatives with diabetes, develop diabetes during the pregnancy, which is known as gestational diabetes in medical terms. If you're obese and your BMI, that is body mass index, is over 30, if you're diagnosed with diabetes, then you will be given advice about your diet and you may be prescribed some tablets like metformin or insulin injections. Other problems are developing high blood pressure and heart disease. So high blood pressure is likely to be related to insulin resistance and to being overweight rather than to the PCOS itself. And high blood pressure can lead to heart problems and it should be treated. Another risk is risk of developing cancer, that is cancer of the lining of the uterus. So if you have less than 3 periods a year, the lining of the uterus, that is known as the endometrium, it can thicken and this may lead to endometrial cancer in a small number of women. There are various ways to protect the lining of womb using the hormone progesterone. And your clinician will discuss the options with you. So this may include a 5-day course of progesterone tablets used every 3 or 4 months, or taking a contraceptive pill, or using the intrauterine contraceptive system that is known as Mirena. The options will depend on whether you are trying for a baby or not. So if you're trying for a baby, then contraceptive pills and intrauterine contraceptive system, that is any type of birth control method, will not be offered to you. PCOS does not increase your chance of breast or ovarian cancer. It can also cause depression and mood swings. So PCOS may affect how you see yourself and how you think others see you. It can lower your self-esteem at times. Also, it can cause snoring and daytime drowsiness, and it can lead to fatigue or sleepiness during the day. It is also associated with snoring. Now, what can you do to reduce the long-term health risks? So you have to follow a healthy lifestyle, eat a healthy balanced diet, which should include a lot of fruit and vegetables and whole foods like wholemeal bread, whole grain cereals, brown rice, whole wheat pasta, lean meat, fish, and chicken. Cut down the amount of sugar, salt, and caffeine that you eat and drink. Eat meals regularly, especially the breakfast. Take exercise regularly, at least 30 minutes, 3 times a week. Maintain normal, healthy weight and healthy BMI. So this BMI is the body mass index, and it is the measurement of weight in relation to height. And the normal BMI is between 19 and 25. If you are overweight, it would be helpful to lose weight. The benefits of losing weight include lower risk of insulin resistance and developing diabetes, lower risk of heart problems, lower risk of cancer of the womb, more regular periods, and increased chance of becoming pregnant, reduction in acne, and decrease in excess hair growth over time, improved mood and self-esteem, and you only have to lose a small amount of weight to make a difference to your symptoms and your health. Now, weight loss surgery may be considered in women who have a BMI of more than 40, and there is no strong evidence that PCOS by itself can cause you to gain weight or makes losing weight difficult. You should also have regular health checks once you have been diagnosed with PCOS. You should be monitored regularly to check for any early signs of health problems like diabetes. So depending on your risk factors, you may be offered testing for diabetes every 1 to 3 years. There is risk of cancer of the uterus. So it is important to have a period every 3 to 4 months to reduce the risk of excessive thickening of lining of the uterus. If you have not had a period for over 4 months, you may need hormone tablets to make you have a period. And you may also be offered further tests like ultrasound scan of your uterus. There is risk of high blood pressure, so you have to discuss with your clinician how often you should have your blood pressure checked and whether you should have blood tests to check your cholesterol levels as well. There can be depression and psychological problems, so you can be referred to a counselor or trained specialist if necessary. Now, very important question is there a cure for PCOS? Unfortunately, there is no cure for PCOS. There are medical treatments which aim to manage and reduce the symptoms or consequences of having PCOS. Medication alone has not been shown to be any better than healthy lifestyle changes. So weight loss and exercise is very important. Many women with PCOS, they successfully manage their symptoms and long-term health risks without medical intervention, and they do this by eating a healthy diet, exercising regularly, and maintaining a healthy lifestyle. So lifestyle modification is very important to reduce the risk of long-term implications of polycystic ovarian syndrome. So this is all about polycystic ovarian syndrome, and I've tried to keep it as simple as possible. So I will be discussing about more topics, and do like and subscribe to my channel, and I shall be uploading more videos shortly. Thank you. Thanks for listening.